Welcome back, everybody. Every Tuesday, News 2 has a doctor on call to answer questions on everything from the latest in cancer treatment to cosmetic surgery. And today we're talking about the latest in eye surgery. And joining us this afternoon is Dr. Ming Wang. He's the director of the Ming Wang Vision Institute. And thanks so much for joining us.
Thank you.
You just explained to me that as we get older sometimes, it becomes very difficult, say, to pick up reading material and be able to see it correctly. In fact, you had kind of a funny name for it.
Yeah, it's called short arm syndrome.
Short arm syndrome. Explain.
As we get older, that actually most people don't know, our arms get shorter.
Is that what it is? You have to hold things way out like this.
That's right, further away. And I always joke with the patient that you chop it right here and extend a few inches.
That'll take care of the problem.
That's right.
Well, a lot of people have been opting for the LASIK surgery, but I know some people just aren't quite comfortable with that. Now, you've come up with something that actually uses radio waves. Can you explain? Yeah,
this is actually approved by FDA now, recently, and actually we performed one of the first procedures in the state recently. And this procedure utilizes a radio wave treatment instead of laser, instead of a knife. So there's no surgery in the traditional surgical sense because it does not use any knife. And what we do is using radio wave to create a bunch of little spots around the eye. So effectively almost create a little shape or like a bifocal, so to speak, a multifocal cornea. So you'll be able to regain or strengthen the reading ability. And specifically for patients over age 40, and you have to be able to see far well without glasses.
Okay.
And the only trouble is short arm syndrome.
Short arm syndrome. Yeah. And what is this procedure called? I've never heard of this before.
It's called conductive keratoplasty, and we call it CK for short. Actually, tonight we have a seminar giving in our center regarding CK, what this technology is about, what type of patients can be qualified, how much does it cost, and what are the risks and the benefit. Seminar tonight at our center at 6:30.
6:30 at your center, which is, tell us everybody again who wants to perhaps see it tonight or go there.
That's right.
Where is it at, I'm sorry?
Oh, at the Wang Vision Institute.
Okay.
And I can give the phone number if you want to, but it's on the phone book, but it's 321-8881.
Okay, and how long does this procedure take? Is this a lengthy procedure?
It's not a lengthy procedure. The procedure itself only takes about 15 minutes or so. And it's essentially painless. We put numbing drops on the eye, lie patient down, and after procedure we sit patient up and we give them a magazine they could not read before the surgery, and put in front of them a 55, 65-year-old person can read all of a sudden without any reading glasses. And I often get questions from patients say, Dr. Wang, does that mean that I'm young again?
Yeah.
You know? And I would say it's not a clock stopper, it's a clock rewinder. So it can rewind the ability to read and reduce the amount of farsightedness by a certain number of years. But your clock's still ticking, and you outgrow that.
At least now you can see the clock, you can see your watch.
Exactly.
How about that?
Exactly.
Dr. Wang, it was a pleasure speaking with you. And if you'd like more information on this topic, you can always go to our website, WKRN.com, for the very latest. I'm just going to say CK, because the other name is just way too long for me. I think Lisa Patton has already decided she wants to sign up as a test patient.
I see.
Thanks so much.
You're welcome.
So we will have more news right after this. Stay with us.